Welcome to the National Association of County and City Health Officials and Center for Disease Control and Prevention's online series, Food Service Guidelines. This training is a result of the CDC-funded Food Service Guidelines Action Institute, which seeks to empower public health practitioners to partner with community institutions to design healthier food service that supports population health, local economies, and the environment. This series introduces several modules of topics to help a variety of community-based institutions, such as universities, parks and recreation centers, large worksites, and hospitals to adopt healthy food service. Let's get started with the first topic of Food Service Guidelines overview. We will discuss what we know and why it is important to provide guidance on food service that provides customer health and well-being. Without access to healthier options, it can be difficult to eat a healthy diet and can often lead to poor health. In the U.S., chronic diseases account for 70% of all deaths each year and are the leading driver of the nation's healthcare costs. Among adults in the U.S., obesity is associated with excess annual medical care costs of almost $2,000 per person, and for those with severe obesity, almost $3,000 per person. Overall, obesity accounts for approximately $173 billion of annual healthcare expenditures. Chronic illnesses such as heart disease, type 2 diabetes, and obesity are often, in part, the result of poor quality diets. Prior to the COVID-19 pandemic, 1/3 of Americans had a cafeteria at work, and half of Americans had vending machines. It is estimated that over 15 million Americans eat from cafeterias or vending machines daily. Food from these venues often do not align with dietary guidance. Fewer than 1 in 10 adults in the U.S. eats the recommended daily amount of fruits and vegetables. By providing guidance on food service, we can work to improve access to healthier foods in communities and help people select healthier foods and beverages that support their health. CDC has developed a set of best practices to adopt food service guideline standards, including the Food Service Guidelines Implementation Toolkit. The Food Service Guidelines Implementation Toolkit provides 4 building blocks to help you get started and set in a positive example for employees, visitors, and members of the community. The building blocks include build a foundation, strategize and act, monitor and evaluate, and expand your initiative. Food service guidelines can be used for foods sold in concessions, such as snack bars, cafes, and cafeteria food service, as well as vending machines and packaged foods in various worksites and community organizations. So, what does it look like when the guidelines are put into action? Communities across the U.S. are working together to improve the availability of healthier foods in food service. For example, in Los Angeles County, California, nutrition standards are required in food contracts across county departments. This policy impacts an estimated 37 million meals per year. Another example is Multnomah County, Oregon, adopting healthier procurement practices and nutrition standards in juvenile detention centers, preparing an estimated 200 meals per day. This led to a 25% increase in fruits and vegetables sourced from a local Black-owned farm, which also offers detained youth an opportunity to gain hands-on agribusiness and urban farming job skills. Food Service Guideline resources, including the Food Service Guidelines Implementation Toolkit, can be found at the website you see on the screen.